Good day everyone. The topic of our discussion will be Module 8, Learners with Emotional and Behavioral Disabilities. So later on, tatalakayin namin kung ano nga ba yung ibig sabihin ng EBD and malalaman natin yung iba't ibang disorders or disabilities ng isang estudyante or ng isang learner. So the presenters for today is Sabado Ailey, San Agustin Dimple, and San Jose Winona. So next, introduction. Educating students with emotional and behavioral disorders or EBD continues to be a challenge for many general and special education professionals. Students with EBD can exhibit behaviors such as chronic classroom disruption, aggression, and general maladaptive behavior toward peers and adults. Some students exhibit depression, or compulsive behavior, and excessive fears and phobias that merit special education programming. Estimates of those served for EBD are approximately 1% of the school population. So the causes can include student biological factors and environmental influences such as family, school, and culture. Educators and researchers are focusing on preventing problematic behaviors, and special educators are developing powerful intervention strategies to reduce these behaviors and replace them with more constructive ones. So in the classroom, most students struggle with behavior or academics at some point in their education. So how do we know if a behavior is isolated or if it is something more serious? Next. So there are few signs to look for in identifying emotional and or behavioral disorders. So one number one is attention issues. So attention issues, students may struggle to stay focused in class or may be hyperactive. So hyperactive or hyperactivity means having increased movement, impulsive actions, and shorter attention span, and being easily distracted. So yung mga students is madali ma-distract and hirap sila sa pag-focus sa klase. Next is acting out. Students may have unusually aggressive behaviors or demonstrate inappropriate emotions, such as excessive laughing or crying. So, people say a child is acting out when they exhibit unrestrained and improper actions. The behavior is usually caused by suppressed or denied feelings or emotions. So acting out reduces stress. It's often a child's attempt to show otherwise hidden emotions. Acting out may include fighting, throwing fits, or stealing. In severe cases, acting out is associated with antisocial behavior and other personality disorders in teenagers and younger children. Next is social problems. Students may find it tough to make or keep friends. They may seem immature or overly mature in relation to their peers. So dito, yung estudyante is mahirap para sa kanila na makabuo or magkaroon ng group of friends. So maaaring mature na sila masyado or immature pa para bumuo o magkaroon ng kaibigan. Next is academic issues. Students may find the work too difficult or too easy. They may fail to complete assignments correctly or at all. So the assignment may be either hard or too easy for the students. So they might completing assignments incorrectly or not at all. So if educators suspect that a student has an emotional or behavioral disorder, they should reach out to the parents and reschedule an assessment with a qualified professional such as a school psychologist. So the student will be assessed using a variety of tests and measures designed to identify emotional or behavioral disorders. So next is objectives. At the end of this module, students should be able to number 1, identify and define the characteristics of children with emotional and behavioral disorders. 2. Compare and contrast externalizing and internalizing behaviors. 3. Describe the causes of emotional and behavioral disorders. 4. Articulate services and instructional approaches for children with emotional or behavioral disorders. Next, emotional and behavioral disorders, or EBD, is a broad category which is used commonly in educational settings to group a range of more specific perceived difficulties of children and adolescents. So both general definitions as well as concrete diagnosis of EBD may be controversial as the observed behavior may depend on many factors. Students with emotional and behavioral disorders exhibit severe, chronic, and pervasive problem behaviors. So, yung chronic condition is a human health condition or disease that is persistent or otherwise long-lasting in its effects, or a disease that comes with time. The term chronic is often applied when the course of the disease lasts more than 3 months. So, the 5 models that are used in EBD are, so una is yung biophysical. Biophysical methods are techniques to study the structure, properties, dynamics, or function of biomolecules at an atomic or molecular level. They encompass a range of techniques including microscopy, spectroscopy, electrophysiology, single molecule methods, and molecular modeling. So second is psychodynamic. It helps clients understand their emotions or unconscious patterns of behavior. By talking through these emotions and behaviors with a social worker, clients come to know themselves better and make better decisions for themselves. So yung pangatlo po is cognitive. Cognitive is a relatively more modern approach to human behavior that focuses on how we think. It assumes that our thought processes affect the way in which we behave. So yung pang-apat is behavioral. The behavioral approach suggests that the keys to understanding development of are observable behavior and external stimuli in the environment. Behaviorism is a theory of learning, and learning theories focus on how we condition to respond to events or stimuli. Stimuli is a thing or event that evokes a specific functional reaction in an organ or tissue. Yung panglima po is ecological. It is a concept of community psychology in which a community or any other social entity is viewed in terms of the interrelations among people, roles, organizations, local events, resources, and problems. It accounts for complex reciprocal interactions of individuals and their environment. So, the idea defines emotional disturbance as follows. A condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. A. An inability to learn that cannot be explained by intellectual, sensory, or health factors. B. an inability to build or maintain satisfactory interpersonal relationships with peers and teachers. C. Inappropriate types of behavior or feelings under normal circumstances. D. A general pervasive mood of unhappiness or depression. Then E. A tendency to develop physical symptoms or fears associated with personal or school problems. So the term emotional disturbance includes schizophrenia. It does not apply to students who are socially maladjusted unless it is determined that they have an emotional disturbance. So it's schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia require lifelong treatment. So overall, a child that is displaying at least one of the above characteristics with significant duration, frequency, and intensity at the school setting, the child's behavior is emotionally based and cannot be explained by intellectual, cultural, general health factors, or other additional factors. Next is categories. So next is internalizing disorders. A child who internalizes their emotions is said to be suffering from depression and experience loss of interest in activities including schoolwork. This goes with one part of EBD federal definition, a general pervasive mood of unhappiness or depression. So the children who internalize can also suffer from anxiety, separation anxiety, fears and phobias, especially in school, obsessive compulsive disorder or OCD, and panic disorder. So internalizing behaviors are actions that direct problematic energy toward the self. In other words, a person who shows internalizing behaviors does things that harm himself as opposed to lashing out at others, which are known as externalizing behaviors. So anxiety refers to feelings of apprehension, fearfulness, or dread. Depression refers to feelings of sadness, self-depreciation, or worthlessness. Children who act out are hostile, angry, and sometimes aggressive or assaultive. So the teachers of these children are asked to monitor medications for side effects and behavioral fluctuations, assist with behavioral treatments in the classroom, reinforce cognitive behavioral interventions related to classroom. Next is externalizing disorder. Words and phrases that are commonly used with children who externalize are extroverted, under controlled, and acting out. So externalizing disorders includes attention deficit hyperactivity disorder or ADHD and conduct disorder. So attention deficit hyperactivity disorder or ADHD is a brain disorder that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and can continue into adulthood. ADHD is the most commonly diagnosed mental disorder in children. Boys are more likely to have it than girls. So these children act out their emotions instead of holding them in. Fighting, bullying, cursing, and other forms of violence are often seen in children who externalize. Next is general characteristics. So number one, have serious learning problems, are often failing older subjects, and are often 2 or more years behind their peers academically. So sila yung madalas na bumabagsak sa kanilang mga subjects and madalas 2 o higit pang taon silang nahuhuli sa pag-aaral kesa sa kanilang mga kaedad. The number 2, have serious problems with making or sustaining happy, gratifying relationships with other children and adults. So, they have serious problems sa pagpapanatiling masaya. Number 3 is, are often socially alienated, ostracized, some are withdrawn. So, social alienation, it is a situation where an individual feels disconnected from a group of which they believe themselves a part, be it friends, family, or wider society. Then, yung ostracized naman is the result of ostracism is extremely anxiety, depression, self-hatred, increased blood pressure, loss of appetite, self-injury, and suicidal thoughts and attempts. This is not only painful but excruciating. Then, socially withdrawn children is frequently refrain from social activities in the presence of peers. So, the lack of social interaction in childhood may result from a variety of causes including social fear and anxiety or a preference for solitude. Next, exhibit behavior that is often obnoxious and surprisingly inappropriate, and the behavior puzzles, frightens, and disgusts observers. So, obnoxious is someone or something that is very annoying or offensive. An example of obnoxious is an upstairs neighbor listening to extremely loud music at 2 o'clock in the morning. So, very unpleasant, objectionable, offensive, exposed or liable to injury, evil, or harm. Then 5, are often anxious and sad. So, they experiencing worry and unease or nervousness, typically about an imminent event or something with an uncertain outcome. Next, number 6, complain about psychosomatic illnesses, especially stomach pains, nausea, and headaches. So, psychosomatic disorder is a psychological condition involving the occurrence of physical symptoms, usually lacking a medical explanation. People with this condition may have excessive thoughts, feelings, or concerns about the symptoms, which affects their ability to function well. Next, some common school-related behaviors are number 1, high rate of absenteeism and tardiness. So, yung estudyante is madalas na mapapansin natin na madalas silang absent and tamad. Number 2, failing most subjects. So, ito nga yung bumabagsak sila sa mga subjects nila, ganun. Then, number 3, not completing assignments. So, sila yung mga estudyante na hindi gumagawa ng assignments or meron man pero hindi kompleto, hindi tapos. Then, number 4, returning assignments late, solved messy, sometimes with written profanity directed towards the children. So, dito may ma-encounter tayo na estudyante na late sila nagbabalik ng assignments nila, tapos ang gulo-gulo, madumi yung sulat nila. Then, sometimes, meron ngang masamang sinusulat tungkol sa teacher niya. The number 5, difficulty in following directions and maintaining attention. So, dito naman is mapapansin natin yung estudyante na hirap sila mag-follow ng direction and hindi sila nakafocus. Hindi nila binibigay yung attention nila dun sa sinasabi ng teacher. Yun lang po, next reporter.
Children with EBD have the potential to succeed in school but lack the secondary skills such as attending, following directions, and using tools appropriately, which lead to school failure. Students with an EBD are more difficult to serve in school due to their emotional reactivity and their behaviors. When a student has a documented disability, he or she is able to receive special services provided by the school. The ideal legislation ensures that the students with the special need are receiving adequate services. Students who receive special education services are outlined in a document called the IEP or Individualized Education Program. An IEP is a formal contract outlining the services and supports the school will provide in order for the children to benefit from the educational program. The mental health of children is a natural and important concern for all of us. The fact is, many mental disorders have their beginning in adulthood or adolescence. So here are the characteristics of EBD. First is avoidance of contact with others, avoidance of eye contact with others. 3 is realistic behavior. The realistic behavior may be defined as an act, a sequence of action or a thought, or a sequence of thought that are repeatedly performed in an attempt to manage anxiety. Chronic disobedience. Children with exhibiting chronic disobedience have something going in their lives that causes the behavior to happen. That something could be at home, environment, or family structure, bully at school, and more on. Next is covert or overt hostility. Covert hostility occurs when the anger of each socially and individually censured, but they still possess or sufficient energy to express some feelings on the matter. So yun nga, may mga kakayanan pa din silang ipahayag yung nararamdaman nila sa ibang tao. Pero yung galit na nararamdaman nila sa isang tao ay lumalabas ng palihim. So halimbawa, ako, galit ako sa kaibigan ko. Kaya sinisiraan ko siya sa ibang tao nang di niya nalalaman. So in this situation, may anger exists comes covertly. Next is disorganization in routine tasks or spatial orientation. Lack of proper planning in routine tasks. Temper tantrums or yung init ng ulo. Disturbance of sleep or eating habits. Hindi pagkakapalagay sa pagtulog or eating habits. Emotional isolation. Ito'y nangyayari po kapag ang isang tao ay hindi kaya o ayaw ibahagi o sabihin sa ibang tao yung kanyang damdamin o yung nararamdaman niya. Maaari silang makaramdam ng emotional breakdown o pagiging manhid. Next is exaggerated or bizarre mannerism or yung pagmamalabis at kakaibang ugali. Fails in tests or quizzes, few or no friends. Frequent or persistent verbalization about suicide, frequent unexplained illness, frequent unexplained crying, low frustration level, hyperactivity, hyper sa mga bagay which show up as short attention spans and impulsiveness. Inability to complete tasks, inability to concentrate, inappropriate noises and verbalizations, poor attention, inconsistency in academic performance, inconsistency in friendship and liturgy. Liturgy o yung pagiging matamlay. Lack of contact with reality, pessimistic o kawalan ng pag-asa sa isang bagay o gawain. Extreme mood changes, phobic type reactions, physical withdrawal from touch, physical aggressiveness towards other or property, rapid or severe changes in mood, denial of responsibility of action, need for constant assurance, repetitive action, self-mutilation, self-stimulation, severe reaction to changes in routines, sexual deviation, truancy. Truancy means mga student na tumitigil sa pag-aaral or pagliban or pag-drop out sa eskwela. Unexplained accidents, unexplained academic decline, lack of motivations, unreasonable fears, verbal aggression, and verbal disruptiveness. So, in additional, ang EBD daw po ay classified sa dalawa. Ito po yung nabanggit kanina, yung externalizing at internalizing. Dagdag ko lang po, yung internalizing, it concludes the emotional disorders such as depression and anxiety. In externalizing, it is a disruptive behavior such as ADHD and CD. Later on, matatakal natin yung ADHD, pero ano nga ba yung CD? CD means conduct disorders. It involves more serious behaviors including aggression toward people or animals, destruction of property, lying and stealing, and skipping school. Siguro pwede ko pong example dito yung truancy. The behaviors associated with CD are often described as delinquency or wrongdoing. Children exhibiting these behaviors should receive a comprehensive evaluation. 3 conditions that must be met. First, chronicity, over a long period of time. This standard is not precisely specified. The literature often says a period of several months is appropriate. The intent of the language is to avoid identifying a student as emotionally disturbed who may be temporarily reacting to a traumatic event in their life. There is a range of ways to deal with the stress of chronic illness, like finding information, emotional support from others, particularly yung family and friends, thinking about possibility outcomes, and so on. Next condition is severity, also known as to a marked degree. This is the qualifying condition of severity and requires that the behavioral problems are significant and have been apparent to a number of school staff members who observe interact with the student in a variety of settings and situations. The student behavior should be compared with their appropriate peer group, and MBTS should decide whether or not the behaviors or emotion exhibited are more frequent or more severe than would typically expected of peers of the same age, gender, cultural group. If the MDT determines these characteristics are present and have existed for a long period of time and to a marked degree, the focus turns to the impact of education performance. The last condition is difficulty in school adversely affect educational performance. The emotional disturbance has an adverse impact on all areas of school functioning including academic, social, emotional, communication, and independent living skills. An adverse effect on educational performance can incorporate all aspects of the child's functioning at school, including educational performance as measured by grades or achievement test scores. 4 is identification. Identification process begins with the screening of the student. The evaluation assesses both behavioral or personality. First is behavior rating or inventory scales. It is a parent completed that provides data on the extent to which executive dysfunction impairs a child in his or her natural setting. BRIEF is a test that has normative data for children aged 5 to 18 years. The behavior rating or inventory skills questionnaire packages arrive the personal manual and package of an 86 questions parent form. The inventory scales allow teachers and standards to gather information and to make judgment about what students know and can do in relation to the outcomes. Ito po yung nagbibigay or nag-o-offer ng systematic way to collect the data about po sa pag-uugali, kaalaman, and also skills ng isang bata. Next is interviews. Interviews the child, teacher, parents, and peers. Interview is important step to know the background of the child, teachers, parents, and skills. Next is ecological assessment. Observations conducted in the home and classroom, isolating factors that appear to affect or exacerbate the child's behavior problem. Social workers are often perform evaluation. Ecological assessment are a type of assessment used with students with special need to see how they perform in different settings. For example, at school, may isang student na sa oras ng klase, kalmado siya, nakikinig siya, maayos yung attitude niya, yung pinapakita niya. Pero sa oras ng recess, palaging mainit yung ulo niya pag nasa kantin. Madaling ma-irritate, parang ganun. Dito palang mapapansin na natin on how they react in different situation or different setting. Another example, Anna seemed fine at home but consistently become anxious, depressed, or scared everything when she go to school. An ecological assessment is to obtain through observation. It can help to determine why the child functions differently in different settings. Next is self-reports, self-concept measures, level of anxiety, impulsivity, or aggression. ADHD has been associated with low levels of self-concept in academic, emotional, social, or physical. Furthermore, the relationship between ADHD and self-concept can be moderated by the level of anxiety. This work is aimed to examine the differential effect of inattention and hyperactivity and impulsivity on academic, social, and physical concept. Panglima po is yung projective tests are developed to help individuals reveal inner wishes, conflicts, feeling, and fantasy. Example dito yung sentence or word completion test. Yung word completion test or sentence ay isang technique para malaman yung saloobin nila or kung paano sila mag-isip. For example, someone present the subject with a series of partial sentence that she asks the child to finish in her own words. Example, I feel absent when blank, or what makes me happy is blank blank. By using word completion sentence, it typically analyzes the personality of a child in terms of what they judge to be recurring attitudes, conflicts, and motivates reflected in them. 6 is achievement and IQ test. It is a test or an assessment that measures a range of cognitive abilities and provides a score that is intended to serve as a measure of an individual's intellectual abilities and potentials. Next is curricular priorities, rules and routines. Routines are very important for classroom management. They must be established at the beginning of the school year. They must be written in simple and understandable terms para mas madali nilang magets yung topic. The wording should be positive because positive words will shape their mind, alleviate stress, and improve their general well-being. Consequences for breaking the rules should be introduced at the same time. They must be applied consistently and firmly. They must be understood clearly and remain constant and predictable. Feedback should be administered clearly when consequences are administered. Students that struggle with transition and unexpected change thrive on routines. So by the use of visual cues to go over a daily schedule for the days, activates can be very helpful for these types of students. Educational placement and teaching strategies. Supporting positive behaviors. These are time-tested strategies for guiding and supporting growth toward more positive, adaptive behaviors. First is token economy. A reward system is standard when addressing the behavior of special needs children. With points or token economies, students are given constant reinforcement for correct behavior and following the rules. Students earn points or tokens for instances of positive behavior on a set schedule. These tokens can then be used to purchase rewards on the token store or prize box. Token economy. In order for a token economy to be effective, positive behavior must be rewarded consistently, and items in the token store must be genuinely motivating for the students. This takes a fair amount of preparation for organization and collaboration with family, but has proven to be quite effective with many students. For example, Mrs. Concepcion has a token economy set up in her second grade classroom. She has a poker chips as her tokens. She has to set up a system to encourage students to read more books and to start reading immediately when they sit down after lunch. Each time a student reads a book, she gives them one token after they have answered a couple questions about the book orally. Once a month, she opens her store which contains different price items according to the token accumulated by a child. So in token economy, naiengganyo yung bata, nahahasa rin yung kaalaman niya, and at the same time, nag-e-enjoy din sila sa pag-aaral. Next is classroom behavior chart. This may appeal to any competitive nature in the students. Students who are behaving progressively will see themselves rising up the chart and surpassing others. Progress is monitored and rewarded. The only downside is that students who perpetually see themselves at the bottom may see that as their identity. Behavioral chart is a visual way to see a child's behavioral progress. A behavior chart can be used to manage a variety of behaviors. There are many benefits to using a different chart to manage behavior. The chart provides a visual representation of how individual kids are doing and it's easy to see while they are in the classroom. For example, in elementary school, Teacher Ann using a big chart and hung in front of the class, and each student was presented by a different symbol. Sometimes it was colors, other times it was happy or sad faces. So Teacher Ann uses a visual chart to track and manage behavior, and she often using a behavior chart. Next is lottery system. This one is simple. Student who show positive behavior place a ticket with their name on it in a jar. Once or twice a week, the teacher will draw out a winner and award a prize. in lottery system, so hindi lahat ng student ay nakakatanggap ng prize. Kung kaninong papel lang yung mabunot ni teacher, siya lang yung makakatanggap ng award. Unlike sa token economy, lahat magkakaroon ng reward. Pero dito, kung sino lang yung mabunot, siya lang yung may reward. Although lahat sila ay nagpapakita ng positive behavior. Next is positive peer review. Has anyone overthought or reversing tattletale? This builds teamwork and social support in the classroom. Encourage students to watch their peers and identify positive behavior. Reward both the reporters and their peers. Positive peer review is a type of evaluative feedback. It focuses on the strengths and areas of improvement for yourself, your team members, or other people. This form of evaluation can benefit all parties involving, helping to build self-awareness and grow in new ways that we might not have realized before. So, peer reviews feedback is a great way to identify your strengths and weaknesses and those of others. It helps you to grow in new ways that may have been difficult for you before, while also making sure that everyone feels confident about their abilities moving forward. Fostering and rewarding positive behavior is now the role of teaching children with emotional and behavioral disorders. Approach: biogenic or biophysical. Biogenic or biophysical model identifies with the view of emotional disturbance and behavior in its actual application to organic or environmental influences. Biophysical explain the human behavior through an analysis of metabolic, genetic, and neurological factors. The biophysical model emphasizes the behavioral disorders are mainly caused by essential physical disorder or disturbance. This suggests that the emotional behavior problems are contained by the person and not attributed to the other environmental predisposition. The biophysical or biogenic aims to explain the behavior of human beings by analyzing the neurological, genetic, and metabolic factors. The causes of biogenic or biophysical for EBD: chemical imbalance, genetic abnormalities, brain dysfunction. First is yung chemical imbalance. Yung chemical imbalance in the brain ay nangyayari when the brain has either excessive or insufficient chemicals messengers o yung tinatawag po na neurotransmitters. And some people claim that these imbalances can cause mental health condition. Dagdag ko lang po dun sa neurotransmitter, ito daw po yung natural chemicals that help the nerve cells to communicate with each others. Next is genetic abnormalities. Based po dun sa nabasa ko sa internet, yung genetic abnormalities or yung genetic brain disorder is caused by a variation or a mutation in a gene. Yung genetic brain disorders is nakakaapekto siya sa development and function of the brain ng isang tao. Some genetic brain disorders are due to random gene mutation or mutation caused by the environmental exposures such as cigarette smoke. Next is yung brain dysfunction. Brain dysfunction, it is characterized by an inability to pay attention, inability to think, or yung kawalan ng kakayahan mag-isip ng maayos at hirap sa pagbasa. The type of severity of brain dysfunction depend on how extensive brain damage is. So, ang pinsala sa utak ay maaaring magdulot ng maraming uri ng dysfunction. Brain dysfunction may be localized or focal and diffuse or global. So, when we say localized brain dysfunction, it is caused by disorders that occur in a specific areas of the brain, like brain tumor, brain abscesses, stroke, head injuries, and certain types of seizure disorders. And when we say yung diffuse brain dysfunction, it is caused by disorder that affect the large areas of the brain, like cardiac arrest, high blood and low blood, Alzheimer's disease, etc. So when the cerebral cortex, which is the outer layer of the cerebrum, it is the largest part of the brain, is damaged, the degree of dysfunction is often proportionate to the extent of the damage. So kung gaano kalawak or kalaki yung pinsala, ganun din daw po kalala yung dysfunction sa utak ng isang tao. Next is intervention, medication, stimulants, and antidepressants. Medication. It is a treatment or procedure or other action taken to prevent or to treat disease or improve health in other ways. Stimulants medication is the most commonly used treatment for ADHD. Stimulants are an effective way of managing ADHD symptoms such as short attention span, impulsive behavior, and hyperactivity. They may be used alone or in combination with behavior therapy. Antidepressants are medication that can help relieve symptoms of depression, social anxiety disorder, and mild chronic depression, as well as other conditions. They aim to correct the chemical imbalances of neurotransmitters in the brain that are believed to be responsible for changes in the mood and behavior of a child. Next is psychodynamic. Psychodynamic, an approach to psychology that emphasizes the systematic study of psychological forces underlying human behavior, feelings, and emotion, and how they might relate to early experience. So, sinasabi po dito na ang mga pangyayari daw po nung tayo ay bata pa ay may malaking impluwensya on our adult lives and shaping our personality. The events that occur in childhood can remain in the unconscious and cause problems as adults. Causes po nito yung unsuccessful negotiation of psychological stages, early traumatic experiences, and inner conflicts. Psychological disorders are caused by emotional problems in the unconscious mind. The causes of these emotional problems can usually be tracked back to early childhood. The best known example of this approach is yung Freud psychoanalytic theory or yung personality. Theory of personality attributes our thoughts and action to unconscious motivates and conflicts. Behavior is explained through unconscious motivation and unresolved inner conflicts from one's childhood. Intervention, encouragement of pre-expression of feelings, reduction of limitations, accepting environment. It attempts to help the clients find patterns in their emotions, thoughts, and beliefs in order to gain insight into their current self. Next is psychoeducational. It is the process of providing education and information to those receiving mental health services. The psychoeducation is a form of education that is especially offered individuals who are suffering from any one of several distinct mental health conditions, impairing their ability to lead their lives. The ideal aim of the psychoeducational approach is to give both the individuals who suffer from psychological conditions and their families a stronger base of knowledge for knowing on ways to cope and thrive in spite of their conditions. Causes is yung negative self-image, anxiousness, undue stress, negative view of environment. Yun nga, kabilang sa causes ng psychoeducation is yung negatibong pagtingin sa sarili, negatibong pananaw sa kapaligiran, pagkabalisa, at kasama po dito yung stress. Interventions support reduction of limitations, accepting environment. The other intervention supports the first is yung conflict resolution on intrapersonal level, reduction of anxiety and interpersonal level, reduction of aggression and other antisocial behavior. Conflict resolution on intrapersonal level or pagbawas ng pagkakabalisa and reduction of aggression and other antisocial behavior. Emphasis on self-concept, self-esteem, and helps children to recognize the authenticity of their feelings and how these feelings affect behaviors. Emphasis on self-concept or yung pagpapahalaga sa sarili at tumutulong sa mga bata na makilala ang tunay nilang damdamin at saloobin at paano nakakaapekto ang mga damdaming ito sa kanilang mga pag-uugali. Highlights the value of relationship, development of control of feelings. A psychoeducation program does not last indefinitely, but in the most ideal circumstances, it can empower a person who suffers from a psychological condition with the skills and thought habits self-regulate themselves in a long run. Next is behavioral. Behavioral approach suggests that the keys to understanding development are observable behavior and external stimuli in the environment. Behaviorism is a theory of learning, and learning theories focus on how we are conditioned to respond to events or stimuli. Models of inappropriate behavior are followed. Or yung pagsunod sa mga hindi angkop na pag-uugali, intervention, reinforcement, and modeling of appropriate behavior. Pagpapatibay or pagmomodel or pagsasanay ng mga naangkop na pag-uugali. Next is social-ecological. Social-ecological model conceptualize health broadly and focus on multiple factors that might affect health. This model considers the complex interplay between individual, relationship, community, and societal factors. The family, friends, laws, and other things around us have an effect on individuals. Interaction between the child and various environments, interaction between the child's needs and demands of societal norms and responsibilities. Adjustment of student environment or both adaptation of environment, teaching alternative behaviors. Health behaviors are determined by an individual's relationships and the environment in which they live. Next approach is humanistic. The humanistic approach emphasizes the personal worth of individual, the centrality of human values, and the creative, active nature of human beings. The approach of optimistic and focus on the noble human capacity to overcome hardship, pain, and despair. The humanistic is a perspective that emphasizes looking at the whole person and the uniqueness of each individual. The personalized system of education. It is the humanistic curriculum is based on the belief that the education is good for a person or is also best for the well-being of the nation. Irrelevant curricula or yung walang kaugnay na kurikula. Authoritarian and rigid teachers. Authoritarian teaching style refers to a teacher who has complete control over their classroom. Ito po yung mahigpit na pagtuturo sa mga estudyante. Di naman maiiwasan na magkaroon talaga ng mahigpit na guro or istriktang guro. So sa ganitong klase ng approach, kadalasan po nakakaramdam ng takot ang mga bata sa loob ng classroom. Minsan nagiging resulta pa daw po ito ng kawalan ng tiwala at malayong loob sa kanilang mga guro. Cause mahigpit na pagtuturo na nagiging dahilan ng pagkaramdam ng takot ng isang bata. Intervention. Pagkakaroon ng bukas na sistema ng edukasyon. Other intervention is cognitive strategy approach, self-monitoring, self-instruction, and self-control strategies are the strategies that improve a learner's ability to process information, more deeply transfer and apply information to new situations. It is a type of learning strategies that learners use in order to learn more successfully. Cognitive strategic develops the thinking skills that will make students strategic and flexible learning. Next is drug treatment, instructional method, and curriculum content. Emphasis on teaching life, academic, and social skills to help children cope with problems. Instructional method and curriculum content, choosing the appropriate teaching method brings instruction to life while encouraging students to actively engage with content and develop their knowledge and skills. Group process or positive peer group refers to how an organization's members work together to get things done. Teacher skills, combination of professional competencies and personal characteristics that produce the best teaching strategies. So ito, pinagsasama-sama yung mga kakayanan at personal na katangian ng mga guro upang magkaroon ng pinakamahusay or effective na diskarte sa pagtuturo. Next po is yung Attention Deficit Hyperactivity Disorder or also known as ADHD. So ADHD is a mental health disorder that can cause above-normal levels of hyperactivity and impulsive behaviors. People with ADHD may also have trouble focusing their attention on a single task or sitting still for long periods of time. ADHD is a condition that affects people's behavior. So people with ADHD can seem restless, may have trouble concentrating, and may act on impulse. Ang mga symptoms po ng ADHD ay may possibility na mapansin sa murang edad. Sa murang edad ng bata at maaaring din po siyang maging kapansin-pansin habang lumalaki ang mga bata at nagsisimula na silang mag-aral. Karamihan din po sa mga case ng may ADHD ay nadadiagnose kapag ang bata ay nasa edad na 3 to 7 years old. Pero minsan, they are diagnosed later as an adult. The symptoms of ADHD usually improve with age, but many adults who were diagnosed with the condition at a young age continue to experience problems. People with ADHD may also have additional problems such as sleep and anxiety disorders. So the research suggests that a reduction in dopamine is a factor in ADHD. No one knows exactly what causes a person to have ADHD, but some researchers have looked at a neurotransmitter called dopamine. As a possible contributor to ADHD, dopamine allows us to regulate emotional response and take action to achieve specific reward. It is responsible for feelings of pleasure and reward. Other research suggests a structural difference in the brain. Findings indicate that people with ADHD have less gray matter volume. Previous studies have shown smaller brain volume and less gray matter in children with ADHD. Gray matter refers to the portion of the brain where the bodies of brain cells are found, such as around the surface of the brain called the cortex. The researchers are still studying potential causes of ADHD, such as smoking during pregnancy. Children born to women who smoke cigarettes during pregnancy, especially when mothers are heavy smokers, are at increased risk for ADHD. So, yung mga mothers or mga ina na naninigarilyo during pregnancy had an overall 60% higher risk na magkaroon ng anak nila ng ADHD compare po sa mga mother na hindi naninigarilyo. Alam naman po natin na masama sa isang ina o sa nagbubuntis ang naninigarilyo dahil magiging cause yun ng complication sa mga bata na pinagbubuntis nila. So, para po sa mga ina na naninigarilyo, fewer than 10 cigarettes per day. The risk of having a child who developed ADHD was 54% higher than non-smoking mothers. For mothers who were heavier smoker, the risk was 75 for non-smoker. Nicotine may cause abnormalities in the brain, while the products of cigarette smoke, such as carbon monoxide, could affect the brain too. Next po.
So, dito naman tayo sa causes of ADHD. So, first is head injury. Second is genetic factors. O, nasa gene na nila yung ADHD or may family history sila ng ganon. Sunod is premature delivery. Next is smoking and drinking during pregnancy. And last is environmental factor. So, next is categories. So, yung ADHD is merong tatlong subtypes. Ito yung predominantly inattentive, predominantly hyperactive impulsive type, and last is combined hyperactive, impulsive, and inattentive type. So, didiscuss ko muna kung ano yung una, which is predominantly inattentive. Predominantly inattentive, people with this type of ADHD have little or no trouble sitting still but may predominantly have extreme difficulty focusing, finishing tasks, and following instruction. This type is most common among girls with ADHD. So, yung mga taong may gantong uri na ADHD ay nahihirapan sila sa pag-upo. It means hindi sila mapakali, patayo-tayo, ganun. Pero mas lalo silang nahihirapan mag-focus sa isang bagay. Nabilis silang ma-distract, nahihirapan din silang tapusin yung mga task na sinimulan nila, nahihirapan sila sumunod sa mga instruction. Yung gantong uri is pinaka-common sa mga batang babae na may ADHD. So, pag sinabing predominantly inattentive, tandaan natin na ito yung nahihirapan mag-focus or having a hard time to pay attention. So, dito naman tayo sa predominantly hyperactive impulsive type. People with this type of ADHD show primarily hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they're talking, and not being able to wait their turn. So, yung mga tao may gantong uri na ADHD, pinapakita nila yung hyperactive at impulsive behavior nila. From the word hyper and impulsive, sila yung matataas yung energy, maliligalig, ganon, at hindi sila nag-iisip mabuti bago gumawa ng isang bagay. For example, salita sila ng salita habang nagtuturo yung teacher, maligalig sila, madaldal, inaabala yung ibang tao habang nagsasalita, and nahirapan sila mag-self-control. Tapos, hindi sila makapagantay kung turn na ba nila kasi nga nagmamadali sila, ganun, hindi sila mapakali. And ang mga taong may gantong uri ng ADHD ay hindi sila nagpapakita ng mga sign ng inattentive. So, dito naman tayo sa last. Combined hyperactive impulsive and inattentive type. This is the most common type of ADHD. People with this combined type of ADHD display both inattentive and hyperactive symptoms. These include an inability to pay attention, a tendency toward impulsiveness, and above normal levels of activity and energy. So, ito yung last na subtype ng combined. Ito naman yung most common type na ADHD. Ito kasi yung pinaghalong predominantly inattentive at predominantly impulsive hyperactive. So, it means na yung tao may gantong uri ng ADHD ay nagpapakita ng nahirapan sila mag-focus, maliligalig sila. So, ganun yun. Pinagsama kasi. So, people with combined type ADHD demonstrate 6 or more symptoms of inattention and 6 or more symptoms of hyperactivity and impulsivity. So, yung may gantong uri ng ADHD, nagpapakita siya ng 6 o higit pang symptoms sa inattention, sa inattentive, and 6 or more symptoms sa hyperactivity and impulsivity. So, dito naman tayo sa mga characteristic or indicators ng ADHD. So, yung diagnosis ay binibigay lang kapag ang isang tao ay may 6 symptoms out of 9 symptoms at hindi bababa sa 6 months. Also, some symptoms must be present before 7 years of age. So, ito na yung mga characteristic. One is inattentiveness or inattention. Make careless mistakes, lacks attention to detail, difficulty sustaining attention, does not seem to listen when spoken to directly. So, parang hindi siya nakikinig kapag may nagsasalita o kapag may kumakausap sa kanya. Fails to follow through on tasks and instruction. So, nahihirapan sila sumunod dun sa task na ipinapagawa at sa mga instruction. Exhibit poor organization, avoids dislikes tasks requiring sustained mental effort, loses things necessary for task activities, easily distracted including unrelated thoughts. So, mabilis sila ma-distract kasi nga hindi sila nakakapag-focus. Is forgetful in daily activities. So, mabilis silang makalimot. So, dito naman tayo sa hyperactivity. Fidgets with or taps hands or feet, screams in seat. So, ito yung mga maliligalig, galaw sila ng galaw. Leave seats in situation when remaining seated is expected. So, ito yung mga tayo ng tayo kahit hindi naman sila pinapatayo ng guro. Experiences feeling of restlessness, has difficulty engaging in quiet, leisurely activities. So, ito yung mga hindi sila mapatahimik. Is on the go or acts as if driven by a motor. Last is talk excessively. So, ito yung madadaldal, hindi na mapigil. So, dito naman tayo sa impulsivity. Blurts out answer. So, bigla-bigla niya na lang sinisigaw o sinasabi yung sagot sa klase. Has difficulty waiting their turn. So, ito, example, recess. Hindi pa siya yung nasa unahan para dun sa pagbili ng pagkain, pero hindi siya makapag-antay. Ganun, parang ganun. Tas, interrupts or intrudes on others. So, for example, may nag-uusap, ito yung sumasabat siya dun sa mga nag-uusap. Next is identification. Most children with ADHD receive a diagnosis while they are in elementary school, but some may not do so until adolescence or adulthood. No single test can identify ADHD, and the symptoms can overlap with those of other conditions. This can make it difficult to diagnose. Assessment must be including the following. So, Karamihan sa mga batang may ADHD is nakakatanggap sila ng diagnosis habang sila ay nasa elementary level or bata pa lang. And yung iba naman ay nadadiagnose kapag sila ay nasa teenager na or adult na. No single test can identify ADHD, so it means na hindi ito ganun kadali. Marami itong proseso. So ito yung mga assessment na dapat i-include. First is true medical and family history. So, titignan dito kung yung side ba ni mommy or ni daddy ay may ADHD. Second is physical examination. So, yun sa physical examination naman, tinitignan dito, tinatest nila dito yung halimbawa sa pagsulat, sa paglakad, sa pagkapit ng ballpen, and also sa pakikipag-usap at pakikipag-communicate nila. So, mahalaga ito para malaman natin kung may kakaibang nangyayari sa kanila. Next is interviews with parents, teacher, and the child. So, yun sa interview naman with parents, of course, mahalaga rin ito na sa ganun ay ma-examine din kung kamusta yung bata doon sa bahay nila. Kailangan makausap yung mga parents kasi sila yung mas nakakakilala sa kanilang anak. Next is yung interview naman sa guro or sa teacher. Kung okay lang ba yung students sa classroom nila, kung may mga kakaibang behavior ba yung nangyayari. Siyempre, mahalaga din yung interview sa bata para malaman kung ano talaga yung nararamdaman nila. The fourth one is behavior rating scales completed by parents and teacher. Then yung rating scales completed by parents and teachers, dito nga is yung behavior ng isang bata, kung yung standard ba ng bata is normal, and if not, possible na may ADHD siya. So, next is observation of the child. So, dito naman sa observation, mahalaga na i-observe yung bata kasi para malaman mo yung mga behavior na ginagawa niya. Kung may symptoms ba siya na isang batang may ADHD. Last is variety of psychological tests to measure IQ and social and emotional adjustment as well as to indicate presence of specific learning disabilities. So, meron kasi may mga bata na may ADHD na matatalino, mataas yung IQ nila. Dito naman ay may gagawin mga psychological test para masukat yung IQ at yung emotional adjustment ng isang bata. Ganun din para iparating yung pagkakaroon ng specific learning disabilities. So, dito naman tayo sa curricular priorities. So, ito yun. First, starting task. Ito yung magsisimula ka ng mga task. Second is stay on task. Ito naman yung hindi yung kunwari, sinimulan mo yung task na yun tapos hindi mo tatapusin. Kailangan mag-stay ka muna doon bago ka lumipat sa isang task naman. Third is completing task. Ito naman yung kailangan kumpletuhin. Hindi yung hindi tinatapos. 4, making transition. 5, interacting with others. So, ito yung makikipag-interact yung mga batang may ADHD sa iba. 6, following through direction. 7, producing work at consistently normal levels. And last, organizing multi-tasks. Next is educational placement and teaching strategies. So, dito tayo sa academic instruction. The first major component of most effective instruction for children with ADHD is effective academic instruction. Tinutukoy dito na yung most effective instruction para sa mga batang may ADHD ay nagsisimula sa effective academic instruction. So, parang sinasabi kasi doon na dapat yung academic instruction para sa mga bata ay maging epektibo. Kung paano dapat maire-relay yung instruction in a way na matututunan ng mga bata. Dapat effective ang pagtuturo na sa ganun ay mas matuto ang mga batang may ADHD. Hindi kasi pwede dito yung basta magtuturo ka lang. Kailangan dito yung mapapaintindi mo sa kanila yung pinag-aaralan. Kasi di ba may mga estudyante hindi makapag-focus, may mga estudyante maliligali. So, kailangan talaga dito yung kalidad ng pagtuturo. Number 2. Student with ADHD learn best with a carefully structured academic lesson 1 where the teacher explains what he or she wants children to learn in the current lesson and places these skills and knowledge in the context of previous lesson. So, mas matututo yung mga estudyanteng may ADHD kung matuturuan sila in a carefully structured way. Kumbaga, detalyado pero klaro. Itinuturo at ipinapaliwanag mabuti ng teacher yung mga lesson na gusto niyang matutunan na mag-aaral niya. Yung lesson na itinuturo niya ngayon is inire-relate niya yung kakayahan at kaalaman dun sa mga napagdaanan nilang lesson. Yung paraang ito ay nagsisilbing daan para mas maituro niya in a structured way yung lesson at maging effective yung instruction niya. So last, in order to conduct the most productive lesson for children with ADHD, effective teachers periodically question children's understanding of material, probe for correct answer before calling on other students, and identify which students need additional assistance. So lastly, in order to conduct the most productive lesson, upang makapagsagawa tayo ng productive lesson na kung saan yung mga mag-aaral o yung mga bata na may ADHD ay nagpa-participate sa class and lectures, dapat yung teachers ay magtatanong sa mga estudyante niya tungkol sa natutunan nila sa lesson. Siyempre, yung teacher dapat sasabihin din kung ano yung tamang answer sa mga question na itatanong niya bago siya magtawag ulit ng panibagong sasagot. And every time na magtatanong siya, doon din ma-identify yung teacher kung sino estudyante yung mas nangangailangan pa ng karagdagang tulong lalo na sa mga lesson proper. Also, yung mga effective teacher daw, bago nila tapusin yung lesson na pinag-aaralan, ina-aware niya o sinasabi niya na malapit na matapos yung lesson na pinag-aaralan. Siguro sinasabi nila ito nang sa ganun ay hindi magulat yung mga student na ibang topic na pala yung pinag-aaralan nila. And chine-check din ng mga teacher yung mga assignment na ginagawa ng student. Then, ginaguide nila yung mga student kapag may bagong activity na gagawin para maiwasan ang mga pagkakamali. Next is behavioral interventions. Effective teacher use a number of behavioral intervention techniques to help students learn how to control their behavior. Perhaps the most important and effective of this is verbal reinforcement of appropriate behavior. The most common form of verbal reinforcement is praise given to a student when he or she begins and completes an activity or exhibits a particular desired behavior. So, yung mga effective teachers, gumagamit ng mga behavioral intervention techniques nang sa ganon, matulungan ang mga bata na kontrolin ang kanilang mga pag-uugali. The most effective of this is yung tinatawag nga na verbal reinforcement. Ito yung pagbibigay mo ng praise sa isang estudyante kung natapos nila yung mga task nila, kung tama ba yung kanilang mga sagot o kung may nagawa ba silang maganda. Example dito, yung sasabihan mo sila ng good job, very good, great job, at marami pang ibang phrases. So, effective ito kasi diba, mas gaganahan ng mga estudyante na mag-aral dahil alam nilang may nakaka-appreciate sa ginagawa nila or sa mga bagay na na-accomplish nila. It is sometimes helpful for teachers to selectively ignore inappropriate behavior. So, minsan daw, nakakatulong sa mga teacher na piliin na hindi pagpansin sa mga hindi angkop na pag-uugali ng students sa classroom. Ang teknik na ito ay particularly na nakatutulong kapag ang behavior ng isang estudyante ay hindi naman sinasadya o ginagawa lang para makuha ang atensyon ng mga guro o kaklase ng hindi nakakaabala sa silid-aralan o hindi nakakaabala sa pag-aaral na iba. So, nakakatulong yun sa teacher para hindi na makalikha pa ng scene sa loob ng room. Kung yung mga bata naman na yun ay hindi naman nakakaabala sa pag-aaral nila. So, pwede mong pagsabihin yung bata after ng class para hindi maka-interrupt ito sa iba. Pwede mo siyang kausapin in a way na hindi magdaramdam yung bata nang sa ganun na hindi na ito maulit or ulitin ng bata. Teachers often find a certain object, such as rubber bands and toys, distract the attention of students with ADHD in the classroom. The removal of nuisance item is generally most effective after the student has been given the choice of putting it away immediately and then fail to do so. So, madalas nakikita ng mga teachers ang ilang mga bagay kagaya nga ng mga rubber band or laruan kasi nakukuha nito ang atensyon ng estudyante na may ADHD sa classroom. Sa mga bagay na ito, mas napopokus ang mga attention nila imbis na sa mga itinuturo ng teacher. Ang pag-alis din ng mga bagay na ito ay pinaka-effective nang sa ganun ay mapunta sa kanila yung attention ng estudyante at hindi sa mga bagay na iyon. Kapag ganun ay makikinig yung mga bata dahil wala na yung mga bagay na nakakapagbigay sa kanila ng distraction. Next is, while some toys and other objects can be distracting for both the students with ADHD and peers in the classroom, some children with ADHD can benefit from having access to objects that are calming manipulatives. So, kung ibang objects kagaya ng laruan na tinukoy kanina ay nakaka-distract sa ibang student na may ADHD, meron naman din mga student na nakatutulong sa kanila yung mga ganong objects para sila ay kumalma. Best example dito yung squeezing stress ball. So, kumakalma sila kapag may mga ganitong objects. So, kapag sila ay kumalma na, it means makakapag-concentrate or focus na sila sa klase. Last is, allow for escape valve outlets or permitting students with ADHD to leave class for a moment, perhaps on an errand, such as returning a book to the library, can be an effective means of settling them down and allowing them to return to the room ready to concentrate. So, ito daw yung pagbibigay ng permission sa mga estudyante na may ADHD na umalis muna for a while sa klase. Pwede gawin dito yung pagbabalik ng libro. Siguro, pwede rin yung pagpapahangin sandali. Pwede ito maging effective na paraan ng pag-aayos sa kanilang mga sarili. And after ng sandaling yon, pwede na silang pabalikin sa classroom kapag handa na ulit sila mag-concentrate sa pag-aaral. So, classroom accommodation. Sit the child near the teacher. This settings assignment provides opportunity for you to monitor and reinforce the child on task behavior. So, paupuin daw yung estudyante sa tabi ng guro malapit sa mesa ng guro. So, ginagawa itong seating arrangement para bigyan ng pagkakataon ang guro na mas matutukan o mas masubaybayan yung estudyanteng may ADHD. Ginawa ito para ma-check niya time to time kung anong ginagawa ng student or kung ano yung behavior na ipinapakita nito. Next is, sit the child near a student role model. This seat arrangement provides opportunity for children to work cooperatively and to learn from their peers in the class. So, paupuin ng estudyante malapit sa isang estudyante na role model. Role model, it means may disiplina sa sarili, may disiplina sa lahat ng pagkakataon. Role model, it means ito yung maganda yung impluensya ng estudyanteng ito. So, makakatulong ito sa bata may ADHD. Itong sitting arrangement na ito ay nagpo-provide ng opportunity para sa mga bata na makipag-cooperate or makasalamuha sa iba niyang kaklase at matuto mula sa kanilang mga kaklase din. And last is, provide low distraction work areas. This seat arrangement provides opportunity for children to work cooperatively and to learn from their peers in the class. So, dapat maghanda ng yung mga guro na isang tahimik na lugar or classroom. Dapat yung walang distraction sa paligid nang sa ganun ay maiwasan yung pagkawala ng focus or attention ng mga mag-aaral sa oras ng pag-aaralan ng pag-take ng exam. Dapat din na idiretso agad yung mga mag-aaral sa silid o lugar na maingat at pribado nang sa ganun ay maiwasan yung mga appearance of punishment. So, ito po yung ADHD. So, ito na po. Thank you for listening. God bless.